Benishek, Ranking Member Brownlee, and distinguished members of the subcommittee. Thank you for the opportunity to testify on H.R. 423, the Newborn Care Improvement Act. My legislation amends Title 38 of the United States Code to improve the care provided by the Secretary of Veterans Affairs to newborn children, and I'm very appreciative of the subcommittee's consideration of this legislation. The motto of the VA comes straight from Abraham Lincoln's second inaugural. He got that idea straight from Scripture. So the challenge for us is to care for him who shall have borne the battle and for his widow and his orphans. This isn't new, as we've already heard this morning. Since September 11, 2011, more than 250,000 women have answered the call to serve. They faced terrorism in the deserts and the mountains of Iraq and Afghanistan. So in the 21st century, we must also consider she who shall have borne the battle. When she returns, what of her children? The finest military in the world is powered by men and women in their physical prime. The young women who decided to serve this country in the armed forces aren't immune from the same questions that all young women face about whether they are to pursue a career, a family, or both. Yet they are offered a health care system that for so many years has been designed to serve men. With the increasing number of female veterans, the VA must expand its care and services to meet their needs. Maternity care tops that list of needs, and I've offered one of the ways that we can help. In 2010, Congress passed and the President signed the Caregivers and Veterans Omnibus Health Services Act of 2010 to provide short-term newborn care for women veterans who receive their maternity care through the VA. Signed into law on May 5, 2010, this legislation authorized up to 7 days of newborn care. On January 27, 2012, the Department of Veterans Affairs published a regulation officially amending VA's medical benefits package to include up to 7 days of medical care for newborns delivered by female veterans who are receiving VA maternity care benefits. The rule, which became effective December 19th, applied retroactively to newborn care provided to eligible women vets on or after May 5, 2011. Since this 7-day authorization was enacted by Congress in 2010, we have learned more about the unique challenges facing female veterans and changing trends in the veterans seeking maternity and newborn care from the VA. According to a study published in the Women's Health Journal this past year, 2008 to 2012, the overall delivery rate by female veterans utilizing VA maternity benefits increased by 44%, and a majority of the women using VA maternity benefits had service-connected disability. Just last week, the U.S. Navy announced that it has tripled the amount of paid maternity leave for personnel in the Navy and Marine Corps. Effective immediately, 18 weeks of maternity leave will be available. Secretary Mavis stated in a press release, with increased maternity leave, we can demonstrate the commitment of the Navy and Marine Corps to the women who are committed to serve. In the same way, unless Congress extends the authorization for length of newborn care coverage provided by the VA, there will be veterans who face difficult financial decisions and complexities in navigating insurance options at the same time that their newborn is fighting for their life. This is why I introduced H.R. 423 to demonstrate Congress's commitment to meeting the needs of female veterans and by providing a little longer for their newborn care. My legislation extends the authorization of care from 7 to 14 days and provides for an annual report on the number of newborn children who receive such services during such fiscal year. Improved data on the trends in female veterans utilizing newborn care will help Congress and the VA better meet their needs in years to come. Should this subcommittee place my legislation on their markup calendar, which I hope they would do, I would request an amendment be adopted adding the reporting requirement to an existing report the VA is required to produce. Although it is vitally important that Congress and the VA have this data, I don't want the VA to produce yet another report when instead we could add this requirement to an existing report. Some may ask why the VA should provide more newborn care coverage to female veterans than the average private sector employee receive. These women have risked their lives to protect our nation. Just because they are no longer serving in active duty does not mean that we have a responsibility to them ends. In fact, to their service to our country may jeopardize the very lives of their future children, and thus responsibility to them is even greater. A recent study examined more than 16,000 births to female veterans. Having PTSD in the year before delivery increased a woman's risk of spontaneous premature delivery by 35%, research showed. This study gives us a convincing epidemiological basis to say that, yes, PTSD is a risk factor for preterm delivery, the study's senior author said. An investigator at the March of Dimes Prematurity Research Center at Stanford University said mothers with PTSD should be treated as having high-risk pregnancies. Premature infants often need longer hospitalizations after they're born and are more likely than full-term infants to die. These premature infants who survive may face long-term developmental problems, and unfortunately the number of female veterans with PTSD is not insignificant. According to the VA, 20% of female veterans in conflicts in Iraq and Afghanistan have been diagnosed with PTSD, and these are not just the female veterans serving in combat. And on a personal note, I know what it's like to be a parent of a little baby who needs intensive medical care. For an extended period of time after my daughter was born, I could not even hold her till she was over 10 days old. So it is my hope that any new mother who has given selflessly to her country wouldn't have to worry about Congress standing in her way as she tries to give selflessly to her own child, and our goal should always be to provide the mother with the best prenatal care she needs to give the newborn the best chance of healthy delivery. To the members of the subcommittee, I know my time is short and I have submitted a statement. This is something that we can do to support those who supported us. In a new and changing world, with women serving proudly and strongly, this is something we can do to protect them and also give best care to them and their newborns when they have served us and into a new world of the VA. And with that, Mr. Chairman, I yield back.
Thank you, Mr. Collins.